Can hepatitis C reinfection happen after cure? Can a person get reinfected with hepatitis C after being cured? The answer is yes. When someone is cured of hepatitis C, it means the virus is no longer detectable in their body, usually after treatment with direct-acting antiviral medications. However, this cure does not provide immunity. So, if a person is exposed to the virus again, they can become infected once more. Reinfection rates can vary based on several risk factors, particularly ongoing behaviors that may expose someone to the virus again. For example, people who inject drugs are at the highest risk of reinfection. This is often due to sharing needles or other equipment used for injections. Studies indicate that reinfection rates among people who inject drugs range from about 2.8 to 11.4 cases per 100 person-years. Notably, the risk of reinfection is higher shortly after treatment and tends to be greater in younger individuals or those who continue to use injection drugs. Over time, if risky behaviors are reduced, the risk of reinfection generally decreases. It is important to remember that while hepatitis C is primarily transmitted through blood-to-blood contact, it is not typically spread through sexual contact. However, individuals with high-risk behaviors, such as injection drug use or those who are co-infected with HIV, should be aware of the risks of reinfection. To help prevent reinfection after being cured, several strategies can be effective. Harm reduction measures, such as needle exchange programs and safe injection practices, play a crucial role. Regular testing is also important to catch any reinfections early. Continued medical follow-up and screening can help identify and treat reinfections promptly. In summary, being cured of hepatitis C does not guarantee lifelong protection against the virus. Reinfection can and does occur, especially among those with ongoing exposure risks. Ongoing prevention, education, and regular testing are essential components of managing hepatitis C after a cure. If you have concerns about hepatitis C or your risk of reinfection, it is always best to consult with a healthcare professional for personalized advice and guidance.